Hi, my name is Kelsey. Wasim and I are joining you today. We're gonna, have a discussion about, various aspects of integration into pharmacy practice. I'm going to talk, mostly about three topics: workforce needs, entry points into the workforce, as well as the licensure process and some of the barriers. And, of course, we want to talk about those a little bit more and, gain some insights from Wasim and what I'm seeing from my project as well. So I'm coming to you from the Canadian Pharmacists Association. I am the director of the IPG Mentorship and Integration Project there. This is a project funded predominantly by the federal government. It's a 4-year project. And like the Pegasus Institute, we provide a lot of information about the different pathways, a lot of information about different, pharmacy careers in Canada, hearing from IPGs who've done it, hearing their insights, getting, the critical information that's not always available through the official channels. We've got virtual mentorship, and the cornerstone of our project is really the paid mentored work placements. So we are, it almost feels like we're really close to the end at this point, but we do still have about half of our placements available. We have 300 in total, and we have over 1,000 mentee applicants, and over 650 mentor applicants. And we've had just some wonderful feedback on the project so far. So all that to say, so thanks for being here. We look forward to talking. And, if you have any questions about our project and the program, I'd be happy to take them. But I'm going to start with workforce needs across Canada for pharmacists. Now, this is an area that, data has been lagging in for so long. We know that nurses and physicians get all the attention in terms of workforce planning, but pharmacists are finally starting to make some headway here. We've been part of the federal, provincial and territorial kind of workforce body. We've advocated for pharmacy inclusion and workforce planning for so long. And finally, it was January 2025 that Health Canada released a report, the first federal report that included pharmacists in the healthcare projections. And right now, we do have a current 1,700 kind of deficient spots of pharmacists across the country, and that's expected to double by 2035. Of course, as has always been the case, rural and northern areas are most impacted by this shortage. You can see that in medicine and nursing as well. And it's, of course, still true for pharmacy. But, more recently, we're seeing this the deficit of pharmacists really impact other areas that used to be immune, like hospital pharmacy, a very popular area of practice for pharmacists, but it is struggling now too. And regionally, smaller provinces, East Coast provinces especially, are very much struggling to retain, both pharmacy technicians and pharmacists, though pharmacy technicians were not included in that report. But you'll see that through, Nova Scotia's, very aggressive recruitment efforts, changes to the licensing process, to FCR requirements. Nova Scotia, they're doing some really innovative things. The College of Pharmacy, they've gone to Jordan, where they know that there's a huge surplus of pharmacists. So, taking that into consideration, and where they know the education is quite similar to Canadians, and they've brought over a number of Jordanian pharmacists. So that's closed now, but I imagine, they'll continue that work. But PEI was also in the news fairly recently in the fall, talking about its struggles to retain healthcare workers. And interestingly, it said that in the past, I think it was 2 years, it had registered 90 international pharmacy graduates in PEI, and most of them had then left. They go to PEI to become licensed, and then they move away because maybe it's a shorter, less costly licensure process in that province, but maybe not the ideal. Longer term area to live. And so they'll move back potentially to Ontario and Alberta. The problem is, and this is something that was recommended in that Health Canada report, is, that longer term tracking of the healthcare workforce is, we don't have it. I cannot believe that in this day we do not have that, but they're calling for that, healthcare professionals from, their first moment in university, give them a unique identifier and follow them throughout their career. And I would say, yes, let's absolutely do that with IPGs as well. We don't have a good understanding of how many IPGs are in Canada at any given time trying to pursue licensure. Or where they go to, maybe they start in Ontario, go to a different province and then move to Alberta. We don't know. And that is, such critical data for workforce planning and to understand pathways and what we can do to support IPGs better. We can't, NAPRA did say in its 2023 or 2024 annual report that in a span of 4 years, they had over 1,600 registrants of IPGs in the gateway. So that would, that's potentially about 4,000 every year. And that's a lot. And we know that many IPGs are not registering for registering, becoming licensed. So that's a huge attrition rate. So that's something that we are dealing with. Some efforts are being made. PEBC has made some efforts to change this, and we'll talk about the licensing process in a bit. But that gives you an idea of what we're looking at in Canada, our healthcare needs. And then another thing that I will actually say is that this is a good time to be an IPG in Canada and trying to become licensed. Back in 2005 all the way up to 2015, we were looking at a surplus of pharmacists, and it was rough out there. Canadian grads were struggling to find jobs after graduation. The supports that are in place now, this mentorship project, the Pegasus mentorship. We've got ISANs in Nova Scotia, and they're also providing national free language and communication OSCE prep courses for IPGs. Not a lot of that was around. There's so many more supports these days that were not available then. Of course, patients, governments, healthcare associations, because of the workforce struggles that we're dealing with, we are demanding, supports. We know that IPGs make up a third of all pharmacists in Canada and 50% of the pharmacists in Ontario. So understanding, you are a huge part of our workforce, and we need to do better at supporting you through the process, both, while it's not necessarily the mandate of PEBC or the regulators to support you, the recognition of needing to support the workforce as a whole, and that's a trickle-down effect. Of course, we need to support you. You're a third of our workforce, but funding for other organizations like ourselves to guide you right through the process and give you those integration supports right from the beginning is so essential. And I think we've demonstrated that over the past few years, and I can only hope that it continues. So that's what I'm going to say about the workforce needs across Canada right now. And before I get into targeted questions for you and Asifa, I just wanted, if you have any questions about that. Yeah, so there are, in terms of getting your foot in the door at a pharmacy, and we do have a scheduled topic on this that we'll talk about more. I would say I am going to go through that. Let's move on to Wasim's discussion first, but let's move back to that. But one thing I will say is there are organizations out there to support that specifically. We recently did a webinar presentation about it. I actually brought some handouts. They're in the other room, but I'm going to make sure I'll have to. Sorry, I meant to bring them into this room. We created a one-pager kind of resource with just that, how to get into a pharmacy when you don't have any previous Canadian experience. That's a struggle for so many, and that we're hearing all the time in the project. But there are, organizations to support that as well. We work directly with Access Employment in Ontario Achieve, I know is here today. What these organizations do is, they'll review your resume with you. They will like conduct mock interviews sometimes, and they'll even, allow you to understand, maybe where, it's different employment cultures around the world, right? Maybe something on your resume, just like, I don't know if you heard the presentation earlier, but you might be missing a key piece of your employment history on your resume that would really make you stand out. But I'm gonna talk about that. Oh, okay, wonderful.
Didn't even know, like, I was searching and I was reaching out to so many other organizations, and I signed up with the Working Center for the Employment Ontario Services. And regarding healthcare, they don't have much.
Oh, really? Okay, well.
So then I was searching on the internet and I reached out to Will in London. They said, like, you have to be there to get our services. But through them, somehow I got Achieved, and I just recently got.
Oh, wonderful. If for some reason that doesn't work, Access Employment, we are project partners with the IPG Mentorship and Integration Project. They have a huge network of pharmacies. We can work with you and get that done. But we'll move on to the kind of entry into practice piece. I'll let Wasim take it from here.
Thank you so much, Kelsey. That was really interesting layout of the land, how the numbers really look like. So I'm the guinea pig of what happened through the years, over the 20 years. So I went through the process, but I always like to start with this code that I watched myself. So this is an elderly gentleman who is trying to return something to the cashier with very limited English. So he's trying to say this back because he doesn't speak the language. The cashier is not able to understand him. So then I came from the line and I tried to facilitate this communication. So the cashier did not go to the middle of the line to try to break this gap. This customer has to go probably 80 or 70%. The cashier will do this, only a little bit. So that's the first lesson. I, as an IPG, have to do most of the work to close the gap. The second thing is, being an IPG myself, I actually can close the gap for my fellow immigrants who are coming here, trying to get them to the healthcare they need. So this is actually implemented in what they call the SDG, the Sustainability and Development Goals from the United Nations, which is a sustainable economic growth and equitable access to healthcare. And this is the IPG role. So personally, my journey, I graduated from the Faculty of Pharmacy in Damascus, and I have both the pride and humbleness that I learned a lot in terms of foundational knowledge. I kept this knowledge, but I know humbly that there are gaps that I did not learn about. So I had to come here and fill that gap. Back in the day, in 2004, data worked well. So employers told the federal government, we need pharmacists. There is shortage. They came to the migration process and they facilitated a faster track for pharmacists. Great, then you're on your own. Whatever happens to you, happens to you. Nobody knows what happens to them. So I was one of those who were invited in 2004. I graduated in 2000. So I made the best decision, which is I attended the IPG program in the UFT. It was a recent program, probably 2-3 years at the time. This was an excellent program that helped me close this gap in terms of knowledge. And the process is lengthy, as you said. It takes a lot of efforts. It takes a lot of cost, time, which is all acknowledgeable, but it is a process that you have to go through. So I went through this process until I end up with having my PEBC, then Ontario license. Now, on the side, I also took my US process because the knowledge is very similar. So I was applying here in PEBC and going to the States and taking the licensing exams there. Fortunately enough, at the time there was a mutual agreement between Ontario and Michigan, so they did not require any internship. So they accepted my Ontario license to be licensed in Michigan, and I kept my license all those years. Although I never set foot in any pharmacy in Michigan, but I'm a licensed pharmacist in Michigan. Then at the time, I made an informed decision that I wanted to go to hospital practice. So I went to Aurelia, which is about an hour and a half north of Toronto. There was a need for rural pharmacists, hospital pharmacists. So that opened the door for me for hospital practice. Now, of course, that was associated with personal sacrifice. We were probably the only immigrant family there. We probably had no access to any cultural food or anything like this. So it wasn't an easy move, but it paid off because it opened the door for me for pharmacy practice in hospital that I will always be regretful for. Another move I did, I went to Saskatchewan where I applied for my master's and PhD. And here the network ladder, what I call it, is essential. I'll just give you one example. So when I applied to my master's in Saskatchewan, the greatest, the nicest person is my supervisor, but he never saw anybody who is coming from, who knows, from overseas. So he was very skeptical about this person who's applying to. So he asked for references. I gave him the names of all pharmacists who worked with me in the hospital, 8 people. Sure enough, he called every individual on that list, the 8 people. So, okay, 7 of them I worked on a daily basis. Even that person that I only probably saw her 2 times, she used to be a specialized pharmacist, even that person. So here's the message, which is having a good impression on every person who is coming to you, building your network, because it will help you getting to the next step. So sure enough, I was there and I did my PhD. Then I moved to Waterloo here in 2014, 2015, where I started as an assistant and associate professor, where I work in teaching undergrad. That's 40% of my time. And then I do research about 40% of the time. So my focus area is about socioeconomic status. So that's the social determinants of health. I work in pharmacoepidemiology, pharmacy practice, and all of those areas, how connect with the socioeconomic status. That's my research program in about 40% of the time. Challenges, in addition to the lengthy process that you have to moving to a different culture, all the financial and familial strains that are on top of everything that is difficult, there is an important thing, which is how integrated IPGs in the Canadian health force. I remember one time in Saskatchewan when I was working in the hospital. So we had meetings every month where people do presentations, the residency presentations. So I'm attending there. I invited a friend to come. We were about 30, 40 pharmacists. So after the presentation, this person comes in and he goes, I think you are the only IPG in the whole room. So I never thought about it. You know, when you are the only student of certain type, you never pay attention to this until somebody comes along and tell you to look at it. That was true. So all those anecdotes about there isn't much pharmacist in the hospital practice, I tried to quantify it in terms of how many people who are licensed pharmacists but working in a hospital. So the way we did it, this is a paper that we published, I think, 2 years ago, 2023, where we looked at all licensed pharmacists in Ontario. And we looked at the country of qualifying education and where they're practicing. And here are the results, which tells you the whole story. If you look at the overall pharmacists in Ontario, about 20% work in a hospital. That's the top line. So 1 out of any 5 pharmacists work in a hospital. When you differentiate between if they are domestic versus IPG, you'll see that almost 1/3 of the domestic graduates reported working in a hospital, as opposed to about 5% in the IPG. Now, this is not taken into account USA as domestic graduates. When we did this, so added the USA graduates, the American graduates, the Canadian graduates, even the percentage was much, much different. So you can see here, if you are a domestic graduate, your likelihood or your odds of working in a hospital is almost 7 times if you are an IPG. If you take the USA into account, it's almost 10 or 11 times. So that was very clear. There is a big gap in terms of the integration. So you are licensed, great, but you are still outside of the hospital practice. So then we said, why is that? What is the reason behind that? We accessed the data from the residency program at the Canadian Society of Hospital Pharmacists. This is where people apply to get residency. Then usually that's the door for hospital practice. And here are the results. So we found, first we looked at the eligibility criteria. What do they say on their website about applicants? Do you encourage applicants to apply or what? So only one program said, that's only 2.5%, international and out of province are welcomed, so encouraged to apply. Everybody else has some vague language. You have to be qualified or something like this. So it wasn't really that clear language. Now, when we looked at the applicants themselves, so about 312 applicants, those who applied with the full papers, they went through the process. How many of them were graduates or IPGs? About 7% only from all of those 300. How many of them actually were successful? Almost 50% success rate as opposed to domestic practitioners or domestic graduates. So there is lesser applicants. Even if they apply good, still the success rate is not that great. So then we went one step further. We sent a survey to all Ontario licensed IPGs, and we told them, what do you think? So our sample is about 300 people, and we found that only 5%, in fact, had residency. Not necessarily from here. They might have residency when they came. And what else? We found that most of them actually, or not most of them, I should say 30% took the bridging program, but only 1% had residency project or residency program in the country here. And then when we asked them about your practice interest, about 1/3 said community pharmacy is my number one, and 1/3 they said that hospital pharmacy is my number one. But if you take community and hospital, you'll have almost most of people, they want to practice in this. And then when we ask them, we have a lot of questions here. Do you want to practice in hospital? What barriers you have? So we looked at awareness. Awareness wasn't really that great. Even there is awareness, the understanding of the internal culture, understanding how to write a cover letter, understanding the requirements of that job for that residency application was also lacking as well. Then about expecting alignments between your education and your job requirements. So I'll just show with you a project that I did with a colleague from the Qatar University. Qatar University was the first to take the Canadian accreditation outside of Canada. Now there are a lot, I think now the number is 11 or 12, most of them in the Arab countries. So what we did is we looked at all Arab countries, the 22 or 23 countries, and then we looked at how many programs of pharmacy there are, how many accredited programs, either by the Canadian accreditation or the US accreditation, and the information that you gave us about going to Jordan to look at graduates, because they have, I think, 3 universities that are accredited by ACP. And there are a lot, about 20% of the projects that we found. So overall, we found 232 pharmacy programs in the whole region, in the whole Arab countries. About 20% were accredited either by ACP or CCAP. But we found a huge discrepancy between how many they need in terms of the pharmacy workforce, so pharmacists per 10,000 population, and how many graduates they provide. I'm not going to go into details here, but the idea here is this is the number of pharmacists per 10,000. So the higher number, the more pharmacists you have. Look at Jordan, for example. They have about 20 per 10,000. That's a high number. It's almost number 1 or number 2 in the whole region. And look at the number of graduates. This is the dots. Oops, sorry. The dots is number of pharmacy graduates per 10,000. You'll see it's 2.9. So they are saturated in their workforce and they are graduating more. So that's a discrepancy that's not good. Now, there are some countries where they have lower pharmacists, so they need pharmacists, let's say, but they have good graduates, so they are probably supplying their domestic needs. And there is the other way around, where they had so many and they are graduating more, which might tell you that this is maybe a good thing in terms of not oversaturated, or maybe they are dependent on international graduates. This is the case of Lebanon. Anyways, I'm not going to do a lot of details in this area. The message that I wanted to speak with you about, since you are early in the process, is number one is look at your door entrance as early as possible. Build your network as wise as possible. Even a conversation you have in a conference like this might open the door for you. I told you about my story about my colleagues. Even very early on in the process, I was fresh off the boat, as they say. I was just the first time in Mississauga. So I went to the pharmacy in my area, on my street. So I found the person there, the pharmacist is from Egypt. So we have some cultural background. So I spoke with him. So he gave me a piece of advice. He goes, probably speak with Shoppers Drug Mart. They might have more jobs.
That's exactly the same. The same thing I had.
So that's always good. So they gave me the piece of advice. It worked with me. Now, back in the day, probably you don't know what this, we had something called Yellow Pages. So we didn't have Google, we didn't have, so you have to read. So I started calling Shoppers Drug Mart with my broken English, every pharmacy on the Yellow Pages, until I was able to get a pharmacy assistant job at the time. Exactly. So start building your network. This person actually who gave me only 4 hours a week was the person who opened the door for me for the next job, and so on and so forth. Give the good impression in terms of punctuality, professionalism, customer care, and the professional demeanor, and then you will start building your process. It's lengthy, it's costly, you have a lot to sacrifice a lot. I worked in a convenience store. I worked in all kinds of factory things. That's natural. This is the immigrant story. Everybody who came to this new land has to go through this. I spoke with people who came here from Holland. I think in the 60s, they had to sleep in a barn for 3 years until they found their first house. This is the immigrant story. This is not for you only. This is everybody who came to this land. My idea here is it is going to take a lot of effort, but start to build small steps, small victories. So that's my little bit of experience I wanted to share, and I'm happy to take questions or discussion from you.
Like my story is identical, except I did not call. I was knocking on doors. Like I almost gave up. At the end, I was like, I decided to work as an Uber. So I went to do, Uber, they need some kind of vehicle inspections like that. So I went to do a vehicle inspection. The guy was asking me, like, your vehicle is arriving, why do you want to like inspection? I was like, I'm new to the country and I'm looking to, to get any Canadian experience. Then he said, you mind working anything? Like he asked me about my background. I said, I'm honest, right? And he said, like, you mind working anything? I was like, of course, I didn't take that. And he said, like, my friend at the oil change location, like right beside I don't remember quite the location. And he said, like, that is like that person is hired. You want me to call him? I was like, yeah, please. He called him, he said, yeah, bring him right now, let me interview. On the way to that oil change location, that was actually when I lived in Ottawa, right after I came. On my way to that oil change location, I found that Shoppers on the right. And I gave it a chance. They hired me. I almost gave up because I knocked at every door and they all said, no, you don't have it. Okay. But that exact Shoppers I knocked, hired on them. And they were desperate. So they hired me right away.
Wonderful. Where are you? Are you licensed now?
No, I passed in. Like I actually stepped away because I run my own business as well.
Oh.
I stepped away and I came back like last November. I passed my MCQ. I passed the EE a while ago, and then passed the MCQ in November. And I passed the CELFIT with the new score now for the language requirement.
I'm taking the IPG program at your team, and I'm gonna take my OSCE. That's the plan in November.
This November. Perfect.
Hopefully things will go fast.
Yes. Oh, that's great. Well, I mean, the next topic is talking about getting your foot in the door. So maybe talking about this, you know, what do I want to say about this? I want to say that it is a challenge. It's a challenge. There, as I mentioned, we have a resource about it. We did a recent webinar about it. You know, you said you covered probably 50% of Kitchener Waterloo.
3 times.
Yeah.
Went back and forth so many times, but still.
So,
Then I asked, like, what's the reason? Then one guy explained me that we post job online and we get around 200, 300 applications now. And what we will see is getting experience. Like out of them, like we will choose one person. That's the reason. I said, like, yeah, I'm going through my process. At least give me a volunteer opportunity so that I can get used to the Canadian healthcare system. So even for the volunteer positions, like they say, like they didn't say anything at first. Okay, we'll see, but like later on, I went to so many promises regarding even volunteer opportunities. Then I asked again, like, tell me what is the reason. Then one person, he said, like, we get from schools, we get the co-op students option. So possibly
volunteer work. You know, you run the risk of being exploited. You know, you will, you step in thinking that you're going to learn something, but then eventually, you know, a few months down the road, realizing, oh, I'm working here and I'm not getting paid. So that's a risk. We do discourage that. What you should be trying to do, it's a tough place. University of Waterloo is right here. Like, if you can, you know, look outside Waterloo, look in the more rural areas, you know, where they
Elmira, yeah.
yeah, and upskill as well. You know, make sure that you're going into the pharmacy demonstrating your knowledge of Canadian pharmacy practice. You know, understanding the difference, understanding exactly what you'll be doing as a pharmacy assistant, you know, recognizing that it is, you know, we all know it's a huge step down, you know, from a pharmacist, but, you know, basically demonstrating both your value, but the humility that it brings to be there and be willing to learn. But there are not enough opportunities to learn about Canadian pharmacy practice, you know, at a low cost, you know, online, but there are opportunities. And just
I joined this program.
Did you?
Yeah,
that's what I was saying. I
You're very well structured and you will get everything.
yeah.
So I
mentioned in my resume.
Yeah.
But
I didn't know, actually. I was just going to mention it to you.
no, and that's what I was offered to talk to you.
Oh, yeah, absolutely.
And you even updated with the crawl software and all that.
Yes.
So I even got insights into how Canadian pharmacy works and what are the roles of the pharmacy assistant and the insurance system, how it works, and the software. So I got insight into all that, and even I got, like, at last one pharmacist here, he just he allowed me just to learn, like not work, like just to learn and just observe. So I just observed, like, one. He didn't allow me to do anything. So he just went through the Silware software, and I went, like, for 1 month, like 1 hour or 2 hours in a week to just go and learn. So I even mentioned that in my resume, that I have a knowledge about Silware and also, like, how the pharmacy works. So I was trying to do all that actually, and your course helped me a lot actually.
Yeah, absolutely. Just reach out anytime. And we have recently started the community forum. So we plan to, you know, keep sharing knowledge with each other, secure Canadian positive community forum.
What courses?
Yeah, I have my own course on Udemy. It's on pharmacy assistant.
Excellent.
It's a practical skill. Just, you know, the things that I learned, because I worked at Shoppers for about 3 years, and then I worked at the specialty pharmacies where we had the IV medication, stuff like that. You know, medical pharmacies, I'm not sure about it.
No,
It's now, I think, called Royal Drugs.
Okay, yeah.
They have a location in Memphis, Mississauga, and they have a location in Arnold.
It'd be great to get more information.
Absolutely, yeah. And we have so it's hospital we need more called in Canada, like bestseller. Then we have recently started a community forum as well for students. So we have like a hub of students coming in. About 100 students every month, new students.
What else? What else can we say? Okay, so talking about Shoppers Drug Mart, I'm interested to know, and I know that we have, folks online. I don't know where everybody is at in the licensure process, or if you've been able to find a job in pharmacy, a first job, that pharmacy assistant role that you need to really gain that experience, gain the confidence. But, Shoppers Drug Mart might hire, what I thought, or what I tend to think is that maybe smaller independents might be more willing to maybe they're slower, maybe there's more time to learn in those environments, but also, Shoppers Drug Marts are bigger. There's more staff, right?
Hard to know for and they usually hire. That's why I always recommend like going to busy plazas. Yes.
So on Weaver, the Shoppers are the busiest, and they called me for an interview. I applied there and said, we are a very busy pharmacy. We want someone who's already trained on this. Okay. So he said, I just want you to just come and join and start your duty as soon as possible, but you don't have an experience because they have health watch. Yeah. So that's what he honestly.
And it's straightforward out there. If you know crawl, you definitely get out there.
Yeah, I thought he would give me, but
now I have to say it is a trade-off, because a busy pharmacy, it might be really, really cruel because you have to hit the ground running. There is no way to learn there. You have to get it right. In a slower pharmacy, you can start learning, but they don't have a lot in terms of their revenue, so they might not have the position. It's a kind of trade-off, so it all depends on, probably in the middle. I remember I worked in one of the busiest, they claim to be the busiest store in Canada. It's in Gate West, Saskatoon. I think they do 1,500 a day prescriptions. So super, super busy. We had probably 4 or 5 pharmacists on duty in any given shift with 8 technicians. So that was not a nice place to learn. It was super, super busy. You have to get the thing. It's like a assembly line. So I wouldn't go with a super busy pharmacy, maybe in the middle. Still, because it takes some time until you get accustomed to the newer system, the health insurance, whatever the case is. So I would go a little bit careful about how busy the store is.
It's very busy. They might hire you for something not actually. For example, I was hired. The first task I was given is to rotate the shelf and getting we had orders every day. Medications. So every day, the start of my shift is to take the medication out of the boxes and sort them and rotate. So they let the other staff focus on the entry and the passport. And then by time I learned and I stepped to the filling. I still was filling, because it's probably filled. And then I stepped into it. That's the story. So sometimes, very busy, consider you for.
Here are some secrets for hospital practice. Not all jobs will be posted under pharmacy. For example, the inventory clerk is under clerical jobs. The person who does medication reconciliation, sometimes it's clerical job as well. It is sometimes not posted under pharmacy related. So you have to be very open when you do your search in careers in hospital. I have seen this. And then you start, once you know the people, you start, I know it's more regulated in the hospital. They need somebody with a pharmacy technician license to work in a hospital usually. But again, if there is any possibility, they will let you know. Now, I don't know about the college, if they still do, again, back in my day, if you had an IPG, you can apply the test to get the technician license. I don't know about this, if it is still applicable. I don't know. I haven't looked at the website for some time.
Yeah, a license. You're doing the PEP, you're doing like you're going through the entire process for a pharmacy technician. I know, we were talking about data. I know that some IPGs do that as a stepping stone. I don't know how many IPGs end up staying as pharmacy techs, and don't pursue licensure. How many fall off, quit licensure and stay, or how many go on to licensure. That's information we just
Don't have it.
But yeah, I mean, another thing, there's other things. There are assistant diplomas, but I wouldn't want you to have to do that. Another customer service or client serving role to get, a lot of the transferable skills that you would need, if they're just looking for Canadian experience, like that's, such a huge barrier, then get it somewhere else, something comparable. You don't know Grohl, you don't know Health Watch, okay, but I'm really good at software. I can pick software up like that, just demonstrating how what you do know is going to work in that pharmacy. But it seems like, you're doing a lot of the right things. Again, I would say utilizing a support like an employment support group like Access Employment, who has those pharmacy contacts, would work for you to help you get it. Again, resume review, interview, mock interviews. I think, don't get discouraged.
Yeah.
You will get it, and then once you get it, we were just talking about the busy pharmacies. Yes, you might get a chance to move up. You might eventually learn, but if that's not working for you and it's not the appropriate learning environment for you, then you've got an in, and keep looking. Keep looking for the environment that's going to really give you that learning opportunity that you're looking for, right? To allow you to ask questions, to allow you to shadow the pharmacist, because that's what you need. You need the time to observe and take it all in, so that you can get the experience and exposure for the exams and for the assessments, right?
Waiting for the one opportunity.
It will come. Don't worry. Just
Regarding the hospital pharmacist,
Mhm.
why do you think it's hard to bring profit after your survey?
So it looks like awareness is a problem. I was speaking with Kelsey about this. It looks like almost 2/3 of IPGs don't even know about the residency program at all. Number two is, even if they know, their competitiveness is not as high as domestic graduates, simply because our students, like in U of T, for example, U of Waterloo, our program, we have co-op. So we send our students to hospitals. Also, we have the rotations. That's a mandatory part. They do a rotation in hospitals. So they have experience. So how to compete with somebody like this if you don't have the hospital experience, okay? Hence, we are trying to find a way to find placements. Now, I know that CPHA program looks at matching IPGs with mentors, but it's strictly community. So if we can find something with more hospital orientation, that's the way. So basically, the awareness and the competitiveness that requires some hospital experience. Now, somebody can still get into the hospital practice. It's not that easy. I showed you for my own story. I had to go to a rural area to find work there. I applied as an intern. When you do your studentship and internship, I applied as an intern. So I was welcomed because they needed people. There was no money at the time. Even actually, when I got my master's, the hospital offered to pay my tuition if I promised to come back. They needed people at the time in the rural areas. So that might be a possibility. So we're just talking about expanding your area where you want to go. I know here in some little towns around KW, you still can get even not only community, even in hospital, if you know how to enter the door. So understanding the culture inside, how to speak with the managers, or either community or hospital, and look exactly what the requirements that they are looking for for that role, and try to adapt your CV from your experiences that works exactly for them. So if they're looking for medication reconciliation assistant, for example, or cleric, they call it, show them that what you have done before actually looks perfect for that position. Paying attention to details, to software, I can do this. So try to adapt this. So this is my advice. Find the way to make your experiences really serve that entry position for a hospital. Here we go. Of course, it's totally, again, Kuwait, they have an accredited program. They are actually Canadian accredited. Their dean was for a few years, Pierre, what is his last name? Morneau, is it? He is now the FPC head. So he used to be the dean there. So they are very similar to Canadian workplace. So here you go. So show that you worked in a very similar workplace and look at those skills that are transferable. Show the employer, but in the end, they are looking at their workplace. They want somebody who can adapt to the workplace environment. Show them that you have worked in a very similar workplace. Okay, so depending on your tasks, what you have done there, choose the one that really serves that position. That I have done this in the previous workplace. Okay. I know the University of Kuwait, it's one of the programs that are accredited by the CCAP. Or even their site. Okay, interesting.
And again, there aren't enough organizations doing this, of course. That's my pitch. Continue funding us, let us upscale. But if you can get a pharmacist mentor, and particularly an IPG who's working in a hospital, imagine the great information that you could get about how to get your foot in the door, what they're looking for. But even if they aren't working in a hospital, or even if they're not an IPG, they'll still be able to provide that information. And whether it's not with a program like ours, like this, conferences, LinkedIn groups, pharmacy associations that hold events that have groups online, online learning, just you gotta get out there and all the ways.
How to connect to the mentorship program?
Pardon me?
How to connect to the mentorship program?
With my program, I have a card for you.
Email Kelsey and she'll get you set.
Yeah. Page handout as well. About getting your first job in a pharmacy. Unfortunately, as I mentioned, I left it in the other room, but just send us an email. I'll know that I met you here, and we'll do what we can to get you in. Now, unfortunately, in order to be eligible for the mentorship components of our project, you do need to pass the exam. But there are lots of online resources, lots of recorded webinars. You get access to live webinars when we hold them. A ton of great information. But we do the eligibility of the evaluation. It's really just to make sure that you are progressing through licensure. That we're not providing those resources to everyone. But hopefully you'll get there. And we are, this project is running for a few more years at least, until we get renewed funding, which we will. We'll just keep
Confidence.
Even my document it took 1 year. I don't know why. Like it was back and forth. Like they said, we didn't receive your transcript from the university, and I contact my team. I don't know what happened, but it took 1 year for me to get even the document.
There's a process for sure.
Maybe
That's one. Yeah, that's the thing. That's one of the things that I always mention to anyone. I think just for actually my life there, I went to the register, got my stamped certificate, and I went to the mail department inside the university, and I mailed myself to these. That's the first step I did, because otherwise I have to run and chase many people that I don't.
that's what I did.
Yeah.
Yeah,
That made it easier for me to talk about.
It's really unfortunate, and you know, we're trying to rectify this, but again, you know, more supports are needed to provide that information much earlier to people that aren't even in Canada yet. You know, you can do all the way up to the MCQ. You can actually do in another country. You don't even have to be in Canada.
Correct.
So, you know, even knowing that, but especially the document evaluation piece that is so difficult to get once you're here and you don't, you know, depending on the country. So that's tough. And it's a long, you know, the data that we have, you know, we did a pharmacies, an IPG survey in 2023, you know, found that over 60% of IPGs take over 3 years. But, you know, even upwards of, you know, 40% will take 4 years to complete the licensure process. So of course that depends, you know, everybody's life is different, you know, it depends what's happening. But, you know, the more supports that we can give through the process, information, community, you know, I more education, like on, you know, I think that there's a big gap between the PVC exam prep courses and the wonderful IPG bridging program at U of T, but you know, it's full time, it's 8 months, and it's very, very costly. So I think
Super intensive, yeah.
Job, you know, while you're doing that, it's a full-time program. So something, you know, I think we need more in between offerings for IPGs that you can do at your own pace, you know, more kind of self-directed. Oh, these are my gaps. These are my individual gaps that I need to fill to feel confident, you know, obtaining licensure. And so we're getting there. But I think a lot of progress has been made.
For sure. Yeah. In my time, 2004, there wasn't much information. So we have to explore all of these options at the time. And then, but I took the IPG. I think that was the greatest advice that somebody gave it to me. So
At the network, get the exposure and access. And, you know, I would recommend them to everyone. I hope they're a wonderful resource. I just know that not everyone and every situation can really dedicate that time. And everyone's looking for a faster way.
Mhm.
Because, you know, like we all have families. We get this right. Okay.
That's why you do see, again, we don't have the exact data, but we know, you know, so many people move to the smaller provinces to become licensed. I do think it's happening after that first, you know, first qualifying exam. You know, if you're unsuccessful, it's like, okay, what are my options?
Yeah, exactly.
You know?
So some people, like, they initially started going to Alberta, but then Alberta started to need some kind of bridging program as well. So now most people are going to Newfoundland.
Yeah.
Newfoundland. Yeah, that's what they don't have a bridging program. So you know, like you get to the license like after the
Well, that's another thing. So this what, you know, we've talked somewhat about the licensure process, and I think we all know, but the information gaps there are critical too, because while we hear, and we don't know for sure, but we have a great, you know, number of IPG participants that we're going to be surveying about this information. But we hear from the colleges that the preceptors in the East Coast provinces are very reluctant anymore to take on IPGs because they're not staying. You know, as I said, you know, PEI gave that they had 90 IPG registrants and they don't have any left. They've all left. So that's it. That's what we're hearing anecdotally. And I do think that, you know, capacity restraints with those regulators, capacity restraints with the SPT programs. You know, you may think that you're going and it's going to be faster and less costly. Now it may eventually be less costly, but you might be waiting months to get your SPT to find a preceptor in those provinces. So there are drawbacks, and not everyone's getting that information until they're there.
Mm-hmm.
So that's kind of why, you know, NAPRA's the gateway is wonderful for giving as much information that it can, but I still think that there's a number of pieces of information that are missing, and that, we can only gain from learning from IPGs themselves. And there's no association of IPGs in Canada, which would be fantastic, but, being able to kind of share the on the ground experiences of what people have been through.
They should introduce any program for like activities to get in pharmacist and role, like for internship type, like at least to get into the door. Yeah. Nowadays it's a little bit harder maybe because there's a lot of competition, especially that's what they're saying, like you move to different to north side or different rural areas. They are suggesting move to rural areas so that because DEA and Kitchener Waterloo is completely saturated.
Yeah, no, I absolutely agree with that. That's one thing that we're trying to advocate for in the project itself is, we know that rural areas are struggling to retain healthcare workers generally, and we know it's a priority among governments. So we're trying to show the wonderful things that you can have in a rural pharmacy practice, the different types of patient care. It's a different environment itself. It's much closer connection to patients, much closer connection to other healthcare providers as well. But yeah, there are definitely drawbacks. But and I think we could also do a lot better job of incentivizing IPG to be working in those areas as well. The federal government recently, included pharmacists in the federal student loan. What is it?
Forgiveness program?
Yes, for Canadian graduates. But, it would be very interesting if they could expand that to IPGs, at least cover some of the costs of their licensure, in terms of, working in a rural area for up to 5 years. I think I would get a lot more IPGs interested in those areas.
But the numbers are clear. There is going to be a need for RPG for the coming few years at least, until 2035. Totally, yeah. It's a gradient. In research, we have something called MIZ, that's Metropolitan Influence Zone. So it comes from 1 to 10. So the closer you are, the more influence. But it is like a gradient. It's not a 1-0 type of thing. So
We've talked about starting before you arrive. Talked about choosing your province strategically. I would just, if you're not already on, but you're like, you'll join our project. We've got opportunities to connect with other IPGs, but even, informal groups, even Reddit, the Reddit pharmacy group across Canada. I often see IPGs posting questions about, I'm thinking about becoming licensed in X province. Does anybody have any advice? Seeking information on those in those forums. Well, I hope this was helpful to everyone today.
Thank you so much.
Awesome.
thank you.